Hello, I am Lee Jong-guk from Apgujeong Oracle Dental Clinic. In today's session, I am going to share what you should do on the first day of clear aligner treatment. Those of you who are not yet familiar with clear aligner treatment can be a bit overwhelmed as the first day of treatment approaches. So, today I am going to tell you what you should do and check on the first day. This is the flowchart that I always use to explain. So far, I've covered diagnosis and ordering. Today, I will talk about more details on what to check after you get the aligners. First, you need to understand the whole time schedule. First of all, you need to know the replacement cycle of aligners. Depending on the cycle, the number of days of patient visits would vary. Usually, one cycle averages about 11 to 14 days. Especially for Magic Align, sometimes one cycle can be shortened to a week. But usually, I think the replacement cycle for Magic Align is about 10 days. Here, I want you to pay attention to the step 6. If you ask a patient to make a visit after wearing all through the step 6 and then perform scanning, it would take another 1 to 2 weeks to fabricate the aligner for the next step. Then, the patient would end up wearing the 6th aligner for another 10 days after already wearing it for the past 10 days. Then, with this extended period of time, all the schedule can be delayed. It will also affect the consistency of treatment. That is why I usually ask a patient to come back in the 3rd or 4th day of the 6th aligner and then go ahead with the fabrication of the 7th aligner after scanning. I take this approach as the teeth movement for the rest of the days for 6th aligner will not be that big. After fabrication of the 7th aligner, I will continue to move on to the next steps. As a default, 6 aligners each time will be delivered from Magic Align. But for a case spanning more than 20 steps, I ask them to fabricate 10 sets of aligners all at once from the beginning. That way, we can have more room to adjust the cycle of patient visits. And the manufacturer will cater to the request of clinicians. So, you can keep this in mind as a tip. Anyway, on the first day, of course you will deliver the aligner to the patient. And another thing to do on the first day is IPR. Mostly, IPR will be performed on the first day. So, after IPR, you can deliver the aligner. And as for an attachment, you can place it on the first day if you deem it necessary. But I think that patients might find it uncomfortable putting the aligner in and taking it out with the attachment on it. So, I usually tell them to wear the aligner without attachments for the first 1 or 2 steps. And after that, I go ahead with placing attachments. This is a routine for me and you can take this as a tip as well. And I usually tell them to wear the aligners for 16 to 20 hours a day. After you get the aligners, you will of course check whether all the aligners and items have arrived and their sequence numbers. All of the aligners have their own unique sequence number, representing the step as well. Here, you can see the marking of U and L, U for upper jaw and L for lower jaw. For example, if the number is L5, this means that it is the 5th aligner for the lower jaw. Why are these numbers important? You will give the patient all the aligners from step 1 to step 6 all together, not one by one. Then, the patient might get confused which one he or she is wearing. That is why you need to tell them to check the number to avoid confusion. I think this is a really important matter to note. Next, we have the starter kit that comes with the aligners. Magic Align is quite generous. In the starter kit, there is a toothbrush and a tool that helps patients take on and off the aligners. Compared to other manufacturers, Magic Align gives more items. And for your information, you can also buy more of these items on Dental website. Now that you have the aligners, you will have to let patients put them in. This is the process of checking the fit of aligners. Most of the time, the fit will be perfect, but sometimes, you may encounter a case where it does not perfectly fit. This can happen, especially for posterior molars. This may be due to scanning errors but mainly due to the fabrication process. They will be fabricated through casting. So, when it is taken out from the cast, deformation can happen here, at the end areas. So, I usually check whether it fits perfectly or not. If the patient says it does not fit, then you will worry about whether you have to make the patient, who already waited for 2 weeks to get this, wait for another 2 weeks. It can be disappointing to the patient. In that case, you can cut the area where the aligner does not fit perfectly. If the usual movement will be around anterior teeth, you can just cut off the posterior area and then ask the patient to come back again after wearing the initial one for 1 to 2 weeks so that you can make another one that can fit more perfectly. There can be cases where you have to make an order again, but unless it does not fit too much, you can use it first after cutting some off, usually the area for posterior teeth. If the aligner floats off the anterior teeth a bit, you can still have a patient try wearing it. About an issue regarding posterior teeth, you have to put more thoughts into it to solve that issue. And you may encounter a case where the aligner is pressing down on the gingiva. This is a straight one, but for Magic Align, due to the margin cutting, this case rarely happens. But if it does happen, instead of having it refabricated, you can just cut the part off a bit by using iris scissors. Like that, you can minimize the patient discomfort. And sometimes there can be mistakes leading to the poor fit. This can happen because aligners are fabricated manually. So, with that possibility in your mind, you have to guide the patient. And there can be some residual powders on aligners due to fabrication issues. So you have to check them, too. Next is about when to perform IPR and place attachments. Mostly, clear aligner treatment will start with IPR, usually in the first step. In the case of severe crowding, you may perform IPR after step 3 or step 6. The order sheets contain that kind of information, such as when to perform IPR, etc. That is why I always put the sheet on my chart so as not to forget. If you just go ahead to the next step, with misunderstanding that you did all the necessary IPR, then the teeth will not be moved as planned. Mostly IPR will be done in the first step, but there are cases where it needs to be done in the later steps. So you have to check for the steps all throughout the treatment. Don't forget this. And when doing IPR, you will use burrs like these. This is a proximal burr generally used in prostheses. And here are very thin burrs. If you use these burrs that are really thin, almost like a needle, you can easily perform IPR from the first step. Maybe I can cover IPR related things in a separate session. And for attachments, you need some of these supplies. I would like to tell you 2 things. There are cases you want to make some preparation in advance. When a patient does not have much time, so we want to prepare for things in advance, we can prepare some resin on the template. In this case, if you keep this in a foil, it will not get hardened and can be used later. Second, I would recommend you to write down the tooth number on the attachment template. This is because we may not know the exact template when a patient comes with the attachment that has fallen off. In that case, if we have this number written on the template, we can quickly find the corresponding attachment. Keep these 2 things in mind. Then you can easily place attachments. And to add one more, if an aligner falls off easily due to the weak fit, you can use attachments on some areas from the first day to make the aligner stay firmly. In particular, attachments on number 6 and number 3, for example, can greatly enhance the fit. Let's say the fit is too loose after the IPR on the first day, then partial attachments are recommended. And you need to inform patients of how to put in and take out aligners and how to clean them. How to put them in is described in the user manual. This is an excerpt from the user manual. You can take time to read it through. Here, I want to make some points out. Patients are usually good at putting in aligners. But some patients are not fully pushing them in, so you have to check it well. You can tell patients to fully push the aligner in. And the starter kit comes with something to chew on, which helps with adaptation. I don't use it well though, but please note that there are things like this too. And removing the aligners is really important as it is hard to take them out. For a severe crowding case, I let the patient push the finger into the palate and take the aligner out. because if you are trying to remove the aligner from front teeth, it won't come off easily. On the contrary, it falls off easily if you make an entry from the molar side. When crowding is severe, it is hard both to put in and take out the aligner. And if attachments are placed from the first day, it will make it more difficult to take the aligner out. That is why I recommend to delay attachment placement for a severe crowding case and tell the patient to take aligner out from the molar side. I think it is also a good way to use a tool. What is good with Magic Align, I think, is that many items are included in the starter kit. So, to wrap it up again, you have to keep in mind this whole time schedule, what to prepare and what to notify patients. With all these things in mind, you can easily do the treatment on the first day without missing things. That is all for today. Next time, I will tell you what information should be shared with patients. Thank you for watching.